Hello, thank you for joining me today for a demo of the provider ranking system. My name is Tom Denniston, and I'm an account executive here at DDI. Before we get started, I want to give you some background about the data. For a provider to be found any year in the provider ranking system, they need to have performed that same procedure code 11 or more times in that year. If the provider is not found, it means they performed the procedure 10 or less times in that year, not necessarily that they didn't perform it at all. The rankings are purely based on the volume of each procedure a doctor provides each year. The provider ranking system does not declare who is an overall good or bad doctor, but ranks each provider's performance with each specific procedure in that chosen year search. However, there is one common denominator: experience. Highest quality evidence from peer-reviewed studies in recognized medical journals have repeatedly shown experienced doctors have better outcomes than doctors who are less experienced, or especially than those who are just learning a procedure. Numerous examples can be found in the articles on our blog, which is the hyperlink found on the upper right at dentistandata.com, just to the left of login, sign up. I'm happy to send you a link directly to any of the blogs I mentioned today if you'd like. If you have that request, please send me an email, tom@dentistandata.com. Here at the bottom of the page, does practice make perfect in healthcare? And about halfway down the page of that blog, I'd like to quote this: a 10-year increase in surgeon age was associated with a 5% relative decreased odds of the composite negative outcome, which is from a 2020 study. At the top of this blog's page, what is more important to you in choosing a doctor? Bedside manner or medical outcomes, i.e., success in performing a service that will get you better and or keep you healthy? Most people would choose number 2, but virtually all the doctor finder services available in the U.S. focus on criteria like number 1. That's what separates the provider ranking system from other provider search systems available on the web. I'll click on Login, Sign Up on the upper right. Brings me to the login page. Now we're on the paid site of the provider ranking system at dentistandata.com. On the left, this is a navigation menu that will always remain visible. Here's the home hyperlink. Then provider search, provider detail, provider ranking. At the bottom, for more info, help, how does it work, frequently asked questions, about us, contact us in terms of use. From here, we can click on provider search to get started. Different ways of searching for a provider could be directly using the NPI number, or by last name, narrow it down with first name, city, state, zip code, and medical specialty. If not knowing the NPI number, we could put in any state, then their last name, or you could just search on medical specialty. I'll start typing surgery, and I'll click on general surgery. I'll type in Houston, and I could do a search based on that, or I could get more specific. Let's try Houston General Surgery. At the bottom of the screen, Houston is a very big city, so we have 24 pages of results at 10 per page. We can adjust that, let's say 100 per page. That will bring us 3 pages. And that's just the first page. Each column is broken up or divided into NPI number, view, which we'll get into in a second to see the details, credentials, first name, last name, type, city, state, zip code. Any of these can be organized alphabetically or numerically if you'd like. And any of the ones on these pages of results, you can search for a specific provider. So it narrows down your search and it helps you find exactly what you're looking for. We can go and clear this previous search we just did by clicking this mustard colored Reset Fields button. And let's type the name of a physician that we are looking for. We know we're looking for by name. I'll type in Lieberman. And I'll narrow it down to Texas. And I'll search from there. So 6 providers with the last name Lieberman in Texas. I can't remember the first name, but I think they were an orthopedic surgeon. So I'll type ortho, narrows it down here, Isidore Lieberman. From here, we can click on view to view provider detail. Now we've arrived at the provider detail page. You can see here that this page includes their NPI number and their physical address. Beneath that are quick view, where you can select from the years available, 2012 through 2018. And also please note 2019 should be released soon by CMS. When it is released, our provider ranking system will be updated at that time. So for this year, for example, 2018, and for every year that you choose, it will tell you the total Medicare dollars approved, in this case, $479,342, which is 1.42% less than the prior year of 2017. Beneath that, the total dollars billed that year, which is 1.23 times higher than the amount that was approved. Under there, 88 unique procedure codes were used in the year 2018. 1,108 number of procedures total were done in that year on 191 patients. So this 1.23 times higher than the amount that was approved. Just for comparison, it's especially important when seeing a patient or seeing a provider out of network. But as a comparison, according to the Centers for Medicare and Medicaid Services, Medicare's reimbursement rate on average is roughly 80% of the total bill. To the right of Quick View is something labeled chart. It's a line graph. This can be displayed in the amount of dollars billed and the amount of dollars approved, or switched to patients in the drop-down menu for the number of procedures done on the number of patients. For whether it's patients or amounts that you're looking at, this is displayed in all of the years released, all the years available, 2012 through 2018, so you don't need to select a year to view that. Just below Quick View and Chart is labeled Demographic, which includes things like whether or not this provider accepts Medicare, what their gender is, and what their type is of practice, like an individual. It also says the average age of patients, the percentage of the gender, the dominant gender of the patients seen, the racial majority, I guess, of the patients seen, the top 5 comorbid conditions seen by this provider, and the average risk score of patients. In this case, 1.4596, 1 being average. Over 1.5 means this provider sees high-risk patients. This part up here, RUCA, I'll click on that. It brings us to the U.S. Department of Agriculture, Rural Urban Commuting Area Codes. If you click on Documentation on the left and then scroll down, it tells you for each code what the classification description is. In this case, they were number 1, so that's Metropolitan Area Core. This opened in a new window, so I'll close this. And from here, we can scroll down to provider detail. And this is for all the procedures done 11 or more times in a year, or over 10, so 11 or more times in a year. This chart is broken up by columns of HCPCS code and description of the HCPCS, then location, F meaning facility like a hospital, O meaning office, dollars, number, repeat percentage, US ranking, and zip 3 ranking. Zip 3 is the first 3 digits of a zip code. So here, green would mean top quarter, yellow would mean top half, and it says click on the ranking for a complete list of providers for that HCPCS code. So in this case, 22614, we'll click on this number 60 for a US ranking to find other providers in the US for fusion of spine bones, posterior. Let's see. That brings us to the provider ranking page. You can see here the top 5 listed have their own colors. And in this chart, provider name, city, state, zip, services, patients, numbers, repeat percentage, total dollars approved, approved average, and billed average. And this list is quite a long one. Shows top quarter in green, top half in yellow. This actually goes so long we don't have to go through the whole end in this presentation, but I just wanted to show you what was there. But beneath the HCPCS ranking is a line graph labeled trending. And these different colored lines in this line graph match up with these MPI numbers of what you see here in the top of this HCPCS ranking list. These first 5. Right now we're looking at top 5 providers by year. However, if we change that to top 10 providers by year, you'll see 5 more colors here in this line graph, and that will also correspond to this list, which just gained 5 more colors as well. Other ways of viewing in this line graph are top 10 providers of all years. This turns into a bar chart, bar graph, then top 5 ranking, and top 10 ranking. We got to this provider ranking section from the provider detail page by clicking on one of these links, which we could do again, or we could just click on provider ranking right here. We can scroll back up if we wanted to do a new search and click reset fields. And in this HCPCS code section, we could enter in a code. Let's do 27446. In this case, I'll say this was done in a facility in the entire US. Look at the different rankings there. And for the year 2018, however, that can be changed. And again, it'll have corresponding list as well as line graph and chart, trending. And the list will be modified as well. If wanting to switch from national to zip 3, we could click filter by zip code and do the first 3 digits of a zip code. That's Houston's main zip 3 code. And then breaks it down there to zip 3 for the same data of ranking and trending. That about sums up the provider ranking system tool for today's demo. If you'd like any more information, as I said in the beginning, reach out. Tom@denistondata.com. I'm happy to give more training or answer any questions. Thank you so much for your time.